Come in.
Hi, my name's Sarah. I'm going to be your student nurse today. We're going to do a small head-to-toe assessment with heart and lung sounds. I'm going to close the curtain so you have some privacy, and while I wash my hands, can you please tell me your name and date of birth?
Heather Cornover, 10/22/03.
Alright, and let me check your band just to make sure you are who you say you are. Are you comfortable?
Yes.
Do you need to use the restroom?
No.
Do you know where you are today?
Oak Hill Hospital,
And what's today's date?
March 9th, 2017.
Okay, so the patient's aware. Before we begin, I'll give you 3 words. Try to remember those until the end, and I'll ask you to repeat them. So they're going to be pizza, dog, and sock. Can you repeat those now?
It's a dog sock.
Alright, so to begin, can I touch your head? Is there any pain or tenderness?
No.
There's no bumps, bruises, or lesions. I'm going to check your temporal pulses one at a time. You can go ahead and close your eyes. I'm going to touch a portion of your face. Just tell me which part I'm touching.
Forehead, nose, chin, left cheek, right cheek.
Keep your eyes closed. We're going to do a hearing test. Tell me which side you hear the sound coming from.
Left, right, right, left.
Alright, you can go ahead and open your eyes. Now I'm going to check your pupils for the reaction to light. Just look at my nose and try not to blink. Good. Can you lift your chin all the way up so I can check your nares? They're clean with no drainage. Alright, go ahead and lower your chin. Open your mouth and say ah for me. Alright, it's pink and moist. I'm going to check your ears. There's no fluid or lesions. And there's no fluid or lesions again. So now I'm going to ask you to follow the pen without moving your head, just your eyes. Alright, good. There's no extra eye movement. Can you make your eyebrows go up and down? Can you smile for me? Can you frown? Can you puff out your cheeks? Can you stick out your tongue? And can you wiggle it from side to side? Sure. Okay, can your head go all the way up and back to your chest? All the way down. Can your right ear touch your right shoulder? And your left ear touch your left shoulder? Can your shoulders go up and down? Okay, now, any pain or tenderness in your sinuses?
No.
Alright, any pain or tenderness in your lymph nodes?
No.
Alright, skin tuber is good. Now I'm going to check your carotid one at a time. Good. And the other side? Now I'm going to listen to your carotid with the bell of my stethoscope. Go ahead and turn your head to one side, and when my stethoscope touches your neck, just hold your breath for me. Go ahead and breathe normally for a few moments. And now we're going to do the other side. So do the same thing. Alright, they sound good. Now we're going to do your arms. So just give me this one. We're going to, any pain or tenderness?
No.
Okay, I'm going to check your brachial pulse. Alright, it's strong. Any pain or tenderness?
No.
Your other radial pulse is strong. Now let's do your radial pulses together. So bring your wrist up. Okay, I would say 2+. Can your arms go all the way out to the sides? Up. And wiggle them on the way down. Okay. Can I see your hands? Cap refills. Less than 3 seconds. Skin tuber is good. Okay, capillary refill again. Less than 3 seconds. Skin tuber is good. Can you squeeze my fingers for me? Alright, push as hard as you can. Alright, and pull. Okay, good. So now we're going to listen to heart sounds. Is it okay if I lift up your shirt and put my stethoscope under?
Yes.
Alright. First we're going to listen to the aortic. Alright, next is pulmonic. then Herb's point. Sorry, tricuspid. And then mitral. Alright, everything sounds good. Now I'm going to listen to lung sounds. Alright, everything sounds clear in the front. Now I'm going to listen to the sides. Okay, good. And now the other side. Alright, good. Now if you could stand up and I can listen to your back. So my stethoscope's going to go under your shirt again, and what I need you to do is every time I move my stethoscope and it touches a new place on your skin, inhale and exhale deeply, okay? Go ahead. Again. And this is the last time. Good, everything's clear. While I have you standing in front of me, I'm going to check your thyroid. It's not enlarged. Any pain or tenderness there?
No.
Alright, you can go ahead and sit back down. Actually lay down for me if you would. Now I'm going to inspect your stomach. So is it alright if I lift up your shirt?
Yes.
Alright. So the stomach is free of lesions. It's warm and dry to the touch. I'm going to go ahead and listen. When was your last bowel movement?
Yesterday.
All right. All right, everything sounds good. No blockages. I'm going to go ahead and palpate on your stomach. Just tell me if there's any pain or tenderness, okay? Anything?
No.
Okay, now I'm going to percuss. All right. Now we're going to move on to your legs. Is there any pain or tenderness in this leg?
No.
All right. And what about in this leg?
No.
All right, we're going to check popliteal pulses one at a time. Good. And the other side. Good. All right, now we're going to go down and I'm going to check your posterior tibial pulses one at a time. Okay, and the other one. Now I'm going to come around and check your posterior tibial pulses. Both are strong. Now we're going to check cap refills. Less than 3 seconds. The other capillary refill. Less than 3 seconds. Okay, if you could come around and swing your feet to the edge of the bed, we're going to check your reflexes, okay? Looks good. Alright, if you could stand for me and touch your toes and hold it. Spine is midline, there's no curvature. You can go ahead and stand up. Walk to and from the dresser for me. Gait is normally and evenly distributed. Okay, can you go ahead and stand facing me? We're going to lift one leg up and the other side. Alright, can you close your eyes and stand like a flamingo with your arms by your side? Okay, and switch. All right, there's a slight sway, but that's normal. All right. You can go ahead and take a seat for me. All right. Are you comfortable?
Yes.
Do you have any questions or concerns about the assessment we did today?
No.
All right. Well, this is your call light. If you need anything, let us know, and your nurse will be in soon to check for you. I'm going to wash my hands. Have a good day.